Hey KEWP fans, I'm here today with Dr. Robin Meek. And Robin Meek is a functional medicine physician in Lexington, Kentucky. And I'm not really sure what a functional medicine physician is, but you started out in the ER, is that correct?
No, I was in internal medicine.
Oh, internal medicine?
Yeah.
And you did that for how long?
20 years.
Okay.
Yeah.
And then moved into functional medicine?
I did.
Can you tell me a little bit about what that is?
Yeah, so, kind of everybody knows what internal medicine is. I tell people it's like, you know what a pediatrician is? Well, internist sees only adults. I don't see children or pregnant ladies. So my training was to take care of adults that had medical issues, and I worked at UK for 20 years in the internal medicine department, and I had issues myself. So the way I got into functional medicine was that I had rheumatoid arthritis, and I guess I still have it, but technically I'm in remission. I don't have any symptoms of rheumatoid arthritis. I developed rheumatoid arthritis. I was on 3 medications and felt terrible. And my joints hurt. I suffered with lots of fatigue. And so I was like, if I don't do something, I am going to be disabled. I was in my 40s, early 40s. And I started to read some books by Dr. Mark Hyman, and some of you all may know him in the functional medicine space. And he was the president of the time of the Institute for Functional Medicine. So his books weren't enough for me. I needed more clinical stuff. So I went to a Institute for Functional Medicine conference, and I was hooked. And basically it is trying to find out the root cause of illness, not just how to treat it, because in the conventional medicine realm, we are taught these are your symptom complexes and this is how you treat it. And sometimes we're taught the cause, but often not the cause. So really trying to figure out what the root of an illness is, and not just you're fatigued or your joints hurt, so let's try this medication or that medication, but why are you that way? And then trying to reverse engineer it.
How do you as a physician do that? I mean, what are the protocols you use to determine the root cause of something?
It's very individual, so people can have the same illness and have many different causes, or they can have different illness symptoms and have many root causes. So, or vice versa. I don't know if I said that right, but so it's a very individual thing. And I use regular labs. I send my patients to LabCorp, and they get all kinds of labs. And then I also do functional medicine testing. So it's advanced, like nutritional testing. I'll look at somebody's nutrition, their vitamins, their minerals, their amino acid makeup that they're consuming, and their fatty acid complexes. I look at their gut and look at their whether they have leaky gut or intestinal permeability. We look at their gut microbiome, what kind of bacteria are growing in their thing. We do.
Are there specialized tests for this?
Yes, there are.
Okay. Is it saliva tests or?
Well, most of mine are blood, urine. There's there's a lot of blood testing, stool testing. I do some advanced hormone testing that is urine, called the Dutch test. So do a lot of different things, and it's a big learning curve to learn how to use those.
Right.
And it's available to your regular physician, but they're not trained on how to do it, and insurance doesn't want to pay for it. Right. So
that's a whole other conversation.
That's a whole other conversation, but it is advanced testing and pretty informative.
Well, I would like, if it's okay with you, to drill down just a second because I like to give the audience something that they can maybe find beneficial. But a lot of people that have rheumatoid arthritis are on, I'm sure, some of these medications that you were on initially, methotrexate, Humira. Those are the ones that I kind of hear about a lot. But what have you done personally to help be in remission with rheumatoid arthritis?
Yeah, well, I completely changed my diet.
Okay.
Completely.
From what to what?
From, I think, what people would call a healthy diet to, I've really been pretty much a paleo diet. I do no grains, no dairy. This was just hard, okay? No grains, no dairy, no legumes, for the most part. Now, I've liberalized my diet a little bit in the last few years because I'm symptom-free. But to clean up my diet in the beginning, lots of protein, lots of vegetables, some fruit. Basically, that's it.
Okay. What do you consume as far as liquids?
Water and coffee.
Okay.
No sugar. So sugar is the devil, as my daughter and I say. It's just sugar is very inflammatory. So
would you be okay with teas, like herbal teas or anything like that?
Sure.
Like hibiscus tea?
I just don't drink it.
Okay.
But I drink water and coffee.
And your kidney function's okay?
It's great.
Okay. Because I've always thought maybe a high protein diet sometimes can confluence with some kidney issues. Is that not the case?
That is not true.
Okay.
Yeah. And Rhonda Patrick, who does podcasts, goes into deep dives about that. You might get slightly elevated creatinine, but that doesn't mean your kidney function is. And I think it would be very hard to eat too much protein. And if you have kidney disease already, that's a different conversation. But if you have normal kidney function, you are not going to worsen your kidney function by eating protein.
Since protein seems to be okay with you, and it's certainly helped you in your life, that is a question that I get from time to time. I ask people in what I do you get enough protein? Because it's really hard to maintain muscle mass. It's really hard to build strength without the building blocks of muscle mass and strength, which is amino acids. And so people may say to me, well, how much protein do I need? Well, I think need, based on what the recommended daily allowances are versus what really do people need, there's a pretty big gap between those. What do you think about protein, and particularly with women? Because I find that women have a harder time getting the protein because some women don't like to eat the meats that some men like to eat. Is there a way that you kind of discuss with people on getting enough?
I think women are woefully behind in the protein space. I think a typical woman's diet, in my practice, I'll say, well, what do you eat in a day? And they'll say, well, I have oatmeal in the morning with a few berries, maybe a few nuts, and then I'll have a salad at lunch, and then maybe I'll have a piece of chicken and a vegetable or two at dinner, and, they'll have maybe a sandwich in there for lunch. They're maybe getting 50 grams of protein. It's pretty terrible. When we are younger, if you're children, like my granddaughter, you absorb all kinds of protein. There is no trouble. You can get protein, out of that piece of bread you just ate. But when you're an adult, and especially when you're reaching my age and older, we have protein resistance, or you have issues with you don't have enough stomach acid, or you're on medication that's reducing your stomach acid. So you're not able to absorb the protein, you're not able to digest the protein. Maybe you have, I find a lot of patients don't have enough digestive enzymes on board for whatever reason, and so they're not digesting the protein they are eating. So I like my patients to get a gram of protein per pound of ideal body weight. So my ideal body weight's about 120 pounds. I try my hardest to get 120 grams of protein a day. The discouraging part is that, I do that. Like I measure my protein. And that's one tool I think women need to do is they need to measure how much protein they're getting, because we can look at a hamburger or a piece of chicken. We think, oh, well, I'm getting, 50 grams of protein. Well, they're not. They're taking 2 ounces of chicken and thinking they're getting enough protein. So I think actually weighing the protein and trying to get 40 grams of protein for breakfast and 40 for lunch and 40 for dinner, it's a lot harder than you think.
And I think a lot of women would say to me, that's impossible for me to do without some sort of supplementation. Now, how do you feel about supplementation?
Yeah, it's not my favorite, but if it's the only thing you can do, then yes. I think whey protein is probably the best source because it has enough leucine. You need leucine to kick on muscle protein synthesis. So you need 3 grams of leucine to kick that on. That's why you need a big bunch of protein. And you want to start your day off with protein. So starting your day off with oatmeal is terrible in my book.
Well, a lot of people are carb loaded in the morning,
Right.
Because they've been trained, probably through
cereal.
media,
Right.
To eat cereal or eat bread, toasts, and things like that for breakfast. So they're setting themselves up for some sugar issues during the day already.
Absolutely.
And you think that maybe a protein breakfast makes more sense?
Well, for a lot of reasons. I mean, it's going to help your energy. It's like you were alluding to, it keeps your blood sugars normal. So when we eat, toast or jam or a bagel or oatmeal for breakfast, for example, we get this big carb load, and then your insulin goes up to handle all those carbs. And what happens is then it dips very quickly, and then we get shaky about 10, if I eat oatmeal 9:30 or 10 o'clock, I'm starving and I'm shaky because my blood sugar's dropped back down. So if you eat protein, even if you eat some of those carbs, but if you eat protein first, your insulin level is just a lot more steady. And so your blood sugar's not doing this all day. And so you're not hungry, shaky, feel terrible, hungry, and then you eat, and it's some more carbs because you get a fast fix. And I find if people do protein loading in the morning, they're not hungry until lunchtime.
Right.
They're great. They're not shaky. They have a lot more energy.
Well, I do consult with people about getting more protein, but I do get pushback from people saying, or particularly women saying, well, I can't get that much protein in. So you think maybe a gram of protein per pound of ideal body weight would be good for people to look at. Well, I work with people who are vegetarians and a few vegans, and they say to me, I really don't see the avenue to 1 gram per ideal pound
And
of body.
I push back on my vegetarian and vegan patients a little bit because unless, if they, some people have a real aversion, they just simply cannot eat it. And you're not going to make somebody eat protein or eat meat, animal protein. But if it's, if there is some way to get them to maybe try fish, if it's just been an aversion or it's just been a habit, then I try to get them to incorporate at least fish. And there are people that are not going to, and so they're not going to do whey protein either. I mean, you can add, tofu and it's just very, very difficult to get that much protein. And the vegetable protein is not as absorbable. It's not as available.
Right. That's a lot of tofu to eat.
It's a lot of tofu. And the other problem is if you're eating beans, say beans and rice to get your complete protein, it's also a lot of carbs.
Yeah.
You're eating a lot of carbs and you're getting a lot of calories. So to get enough protein as a vegan or a vegetarian, and I know this for some of your clients, this will be hard to swallow. It's hard for my patients to swallow too, but they're going to eat a lot of calories and they're going to gain weight. Or they're not going to have, and I'm just going to tell you this story, but I had a patient that had been a vegan for 40 years. She had become a vegan, and that's why I asked, find out why is it you're eating this way? But she thought it was the best way. Her husband had gotten cancer.
Okay.
They thought it was the best way to treat his cancer, which there are people out there that are saying that's the best way to treat cancer. So they completely changed their diet, became vegan. Well, she came in to see me at 73. I'm going to be 70 next month. So this is only 3 years older than I am. She was unable to walk up a step. She couldn't get into her house by herself because it had a couple steps. And she was nearly in a nursing home. If it wasn't for a neighbor, she would have been in a nursing home. And I actually said, if you don't have a spiritual or this ethical reason that you can't eat animal protein, I want you to start eating protein, chicken or fish or something. And just that adjustment in her diet. Now, she wasn't eating as much as I wanted her to, but just that adjustment. First of all, her hunger got turned on and she started actually eating. She'd gotten down to 100 pounds. And she's 5'6", 5'7", 100 pounds is skeletal.
Right.
So she started gaining weight. She started putting on muscle. She could walk into her house by herself. And I think she's avoided the nursing home. So, to me, my personal priority is to keep my bones and my muscles strong. And so I'm right there with my patients. I'm doing the same things I want them to do.
Yeah, I would agree with you that for a vegan particularly, why have you chosen that as part of your lifestyle? And there are lots of reasons for that.
There are lots of reasons.
But if your reason was because you thought that maybe it would prevent certain types of illnesses that you didn't currently have, then I think you should have a real conversation about changing that lifestyle to being a little more, at least balanced. Because I have found that anytime you choose any diet that is extreme, you tend to tip the balances in the wrong direction sometimes.
Yeah.
And if you're more protein oriented, that's okay, as long as you're still getting in your
other nutrients,
your whole grain foods that you can consume without any trouble. Or when you become a vegan, or even the fasting people who do 3 to 5 day intermittent fasts, I worry about that some as well. Now, are there benefits to fasting? Absolutely. I'm sure that there's wonderful benefits to it. But at the same time, you just need to examine, why are you doing it?
Yeah, why?
And if the why can't be very clear, then I think you should have a conversation about other options.
And I know that a lot of people don't want to eat animal protein because they're concerned about the animal welfare. And I'm an animal lover, so I understand that. But if you buy humanely raised and slaughtered animals and, wild caught fish, and they're paying attention to how the animal is being treated, you might be able to overcome some of that.
Yeah, when I have conversations with vegans about why they choose to be vegans, I get a lot of the moral issues and the planet, the environment, factory farming. We propagate factory farming by consuming animal products, and they're opposed to that. So I understand that the reasoning can be very valid, but at the same time, if your health is a value to you, you need to consider doing some things that are also productive to the environment and your morality, but at the same time help your personal health, so that you're not down the road prematurely entering a nursing home or
Right.
becoming someone that they're having to take care of you.
Right.
You know, so we don't want that either. Another thing that I get, Robin, with people that I see is energy. I'm a low energy person. I used to have abundance of energy, but now for whatever reason my energy is low. Is that something that you look at in your practice to
Yeah,
help
I would
people
say
with?
probably the number one complaint of all of my patients is fatigue. So, I think protein malnutrition or, insufficiency is a big factor in that. And a lot of times when I get them to start eating more protein they'll come back a few weeks later and say, I'm already better. Like they're maybe not well, but they are significantly better because they're eating more protein. The other thing that you were asking about supplementation, something I've started because even with all the protein, one measure of your, kind of health status is measuring a prealbumin. And I was horrified. One of my physicians ordered a prealbumin on me, and I was on the lower end. I was still normal, but for all the protein I'm eating, I expect to be much better than that. And so I just don't think I'm absorbing it. So one thing I've started, and this is since you and I met last, is I'm taking the perfect aminos.
Okay.
And doing one or two, and those actually are vegan.
Okay.
But it has the right complement of amino acids to help build protein. And you don't have to digest it. Your body just absorbs it because they're in a free form. So you don't have to break apart the protein to get the amino acids. So I take one or two servings
We'll
of that a
put
day.
the link of that in the description for people who may be looking for that. We'll include that in the link. So
Yeah,
just
because
check.
I think that's for somebody that's absolutely adamant that they're going to stay a vegetarian or stay vegan. The other argument against those things is your brain, right? You need a good fatty acid. So anyway, is taking a amino acid supplement.
Now, for you, the albumin, were you excreting it in your urine? Were you testing for that?
Well, yes, part of that is what else I've got going on medically, but
Okay.
yeah.
The fatigue for people, obviously, as humans, we're living a longer lifespan. The health span, we can argue about whether that's
Right.
improving or not as we're getting older, but we're certainly living a little bit longer. And energy does tend to decline when our hormones start to decline and we age, but the mitochondrial health is something that also plays a
Yeah.
role in energy. Do
Yeah.
you want to speak to that at all?
Yeah, I mean, I think, so mitochondria, if you remember from school, are the called the powerhouses of the cell, right? So we have mitochondria in every cell of our body, especially in and depending on the tissue, they're more abundant. So especially in our muscle, our skeletal muscle that helps us move, in our heart, and in our brain, we have the most mitochondria. Mitochondria can be damaged. We also can actually grow more mitochondria. So one reason we want to exercise is because that causes mitochondria to propagate. So we have more mitochondria in our skeletal muscle. So exercising actually improves your energy just because we make more mitochondria. I think one of the things that is causing mitochondrial dysfunction or, they're not working to their extent is light. So I think we are in a light.
Sunlight or just light in general?
So this light that we're under right now is damaging our mitochondria as we speak. So artificial lighting is full. So if you think about sunlight, you think it starts out red at sunrise. It gets bluer and bluer during the day. It has all kinds of UVA, UVB, and then towards sundown, it becomes red again. After sundown, there is no blue light. We don't get blue light, from, because the sun is gone. The sun is gone. And so, but we have all this artificial light at night. So it is telling our mitochondria that it's keeping us activated. So our sleep is bad. And the mitochondria act as light and environmental sensors. So we have, mitochondria in our skin, all of that. And I think we are not getting enough sunlight. As you know, I try to get sunrise every morning. I drove here with my windows open so that I could get UVA because I kind of missed the UVA window this morning. So I drive with my glasses up, which is maybe not the safest thing to do, to get light in my eyes with my windows down. So red light especially, and everybody's heard about red light therapy. Red light's very energizing to your mitochondria. We absorb the red light and it improves the energy of our mitochondria. So trying to get as much skin exposed, getting sunrise without your glasses, without contacts, is very important in the morning. So it sort of sets the stage for the rest of the day. And then we have UVA rise, and UVA happens about an hour after sunrise. And we get this POMC, which I'll probably mess up how to pronounce it. It's opiomelanocortin, which is a propeptide. When light hits our retina, so our retinas are really an extension of the brain, it cleaves or breaks this POMC peptide apart, and we get release of melanin and melanostimulating. It was leptin resistance, and I was alluding to that before, but when we have all this blue light stimulation, we're increasing our leptin. So people become leptin resistant. And I think most of us are leptin resistant. We're so exposed to artificial light that our leptin is really high and we're hungry all the time. And so we eat. And if we were to eat more in line with the sun and reduce our blue light exposure at night, I think that helps improve that leptin and leptin resistance. But I don't know.
Well, are you suggesting that as humans, and we've talked about biorhythms of humans, that we're programmed to awaken when the sun is up, and we're programmed to go to sleep when the sun is not up, but we have created environments that tend to interfere with that, from our media that we look at, either a phone, television, keeping the lights on in our home. Therefore, it takes our brains a little while to calm down when we turn the lights off and maybe don't fall asleep.
Well, and they've done these studies where they put women to sleep in completely dark light and, completely dark environment. And they put taped lights behind their knees. And in the middle of the night, they turned those lights on and all the women woke up.
Really? It's fascinating.
So nothing in their eyes. We have light sensors all over our body. So when we're sleeping in a room that's less than dark, maybe I have a lot of patients that sleep with their TVs on. Oh, I just want to cry. Like, it's just terrible. So they have their TV on, or they are looking at their phone. They're scrolling through their phone before they go to bed. That's just interfering with that leptin and interfering with their hormones.
Well, I would like for you to speak to a few people who may be watching this video who constantly call me crazy because I tend to awaken and sleep with the seasons.
Yes.
So in the summertime, I tend not to go to bed until a little later,
Right.
and I get up pretty early. But in the wintertime, I still go to bed when the sun is not shining. So sometimes I'm in bed at 6 o'clock and people look at me like I've
Wow.
got three heads saying, you can't do that. You know, you're that's too early.
No, I think,
To go
I
to
mean,
bed.
if you can sleep, no, I
Now,
wouldn't be
I
able
get
to
up
sleep.
early. Now remember,
Yeah.
I do get
Right,
up
you do
early.
get up early.
But I can pretty easily go to sleep. If there's no sun, I can pretty easily go to sleep.
I think that's great. I mean, I think that's what
Tell
we
them.
should be doing. So we should be sleeping, waking, and sleeping with the sun. We should be eating with the sun. So all this intermittent fasting, what we have to be careful of is, like I have a lot of patients that say well, I'm intermittent fasting, so they don't eat breakfast until 1 p.m., but then they eat until 8 or 9 p.m. So we need to eat within an hour of the sunrise, and then we need to stop eating at sundown. And I try to stop 3 or 4 hours before I go to bed. So in the summer, I stop a lot. You know, it's light out now till 8:30 or something. It's way too late to be eating. But yes, we should be sleeping more in the winter and less in the summer.
Right.
And you'll naturally do that if